There can be a lot of judgment, there can be some recoil, and that's why people need to upskill their knowledge in terms of HIV and what the risks are.
So it's important to know that you can't catch HIV from normal social contact, so you can't catch HIV. It really is only transmitted sexually or through contaminated blood.
The problem is that there's stigma. So if you disclose, or when you disclose that you're living with HIV to a sexual partner, the virus is controlled and you're not infectious.
AIDS and HIV caused panic and fear once first discovered. Now more than 37 million people across the globe have this disease. How did this disease really form and spread? Let's find out. The origins of AIDS. Acquired immunodeficiency syndrome, or AIDS, is a condition caused by the human immunodeficiency virus, or HIV, that attacks the body's immune system, making it vulnerable to infections and diseases. AIDS has been a major global health issue since its discovery, causing millions of casualties and affecting countless lives. AIDS was first recognized in the summer of 1981. Young gay men began falling ill and facing demise of opportunistic infections their immune systems should have fended off. Those afflicted became emaciated and often developed dark purple lesions on their arms and faces due to a relatively rare and aggressive form of cancer called Kaposi's sarcoma. In cities such as New York and San Francisco, prematurely old young men became a common sight. Physicians were baffled, and fear spread through the gay community with every new case of what was termed the gay plague. Almost without fail, patients experienced a rapid downhill course and demise as their doctors vainly treated one opportunistic infection after another. Because AIDS, a name recommended by the Center for Disease Control in September 1982, was most common in gay men and intravenous drug users, early theories about its cause focused on lifestyle issues, including immune overload from multiple infections, use of amyl or butyl nitrate poppers, a reaction to semen, infection by an unidentified fungus, and multiple intimate partners. The appearance of AIDS in Haiti fueled speculation that the disease had originated there. These theories were not really compelling at all and instead added fuel to the fire, increasing fear and prejudice around the newly discovered disease. By late 1982, epidemiological evidence indicated that AIDS was an infectious disease transferred by bodily fluids and by exposure to contaminated blood or blood products. Without a test for AIDS, blood banks had difficulty safeguarding the blood supply. Surrogate markers such as hepatitis B core antigen proved imperfect at best. Thus, the blood supply remained unsafe for years, and many people were transfused with contaminated blood. One such person was Elizabeth Glaser, who in turn transmitted the disease to her unborn child, Ariel. Their demise triggered an outcry for more research and ultimately led to the formation of the Elizabeth Glaser Pediatric AIDS Foundation. Approximately 15,000 hemophiliacs in the U.S. became infected with HIV as a result of transfusion with contaminated blood products between 1981 and 1984. Similarly, intravenous drug users were at high risk due to the exchange of blood during needle sharing. The first needle exchange program was set up in Amsterdam in 1984. Such programs would rapidly spread in Europe but not within the U.S. In 1983, scientists found a new virus that they believed was the cause of AIDS. They looked at tissue from a patient with a related illness called acute lymphadenopathy. The virus looked different from other viruses that had been found before. However, they weren't sure if this new virus was the true cause of AIDS because they only had one sample to study. Later, another group of scientists led by Robert Gallo found evidence that this new virus was indeed the cause of AIDS. They found the virus in people with AIDS and not in people without the disease. Another group of scientists led by Jay Levy also found the virus independently. In 1986, a committee of scientists recommended that the new virus should be called the human immunodeficiency virus. Isolation of HIV enabled the development of the first blood test in 1985, a step that offered great hope to both the scientific and other communities. How HIV functions. The human immunodeficiency virus attacks the immune system, which is the body's defense against diseases. When someone is infected with HIV, the virus targets and infects specific cells called CD4 cells, which are a type of white blood cell that helps fight infections. The HIV virus works by attaching to the CD4 cell and entering it. Once inside, the virus hijacks the CD4 cell's machinery to make copies of itself. These copies of the virus then leave the CD4 cell and infect other cells, continuing the cycle of infection. As the virus multiplies, it destroys the CD4 cells in the body, gradually weakening the immune system. Over time, this weakening of the immune system can lead to a condition called acquired immunodeficiency syndrome. AIDS occurs when the CD4 cell count falls below a certain level, and the immune system is no longer able to fight off infections and diseases. Without treatment, people with AIDS are at a high risk for developing serious and life-threatening infections and cancers that can be difficult to treat. There are several ways in which HIV can be transmitted from person to person. The most common ways are through unprotected intimate contact, sharing needles and other injection equipment with someone who is infected, and from mother to child during pregnancy, childbirth, or breastfeeding.
And in reality, globally, more than 50% of the people living with HIV are women. So anybody can get HIV. They'll live a long and healthy life. But if somebody acquires HIV, they'll need to start treatment, which will control the virus so it's manageable. They will need to take medication for the rest of their life.
HIV is not transmitted through casual contact, such as hugging or shaking hands, and cannot be transmitted through the air or by sharing food or drinks. However, this was a fact that took the world some time to accept. In 1985, Ryan White, a 13-year-old boy with hemophilia, was banned from school because he was infected with HIV. Rock Hudson passed away due to AIDS, the first such celebrity to be stricken, and President Ronald Reagan finally mentioned the word during a press conference. More positively, Princess Diana personally visited patients of the disease and shook hands without gloves, visibly demonstrating to the world that the virus is not casually transmitted. Myths about AIDS/HIV. There are many myths and misconceptions about HIV/AIDS that can lead to fear, stigma, and discrimination against people living with the virus. These myths contribute to the spread of HIV by promoting misinformation and discouraging people from getting tested and accessing the care that they need. The most common myth is that only certain groups of people can get HIV, when in reality HIV can affect anyone, regardless of age, gender, orientation, or race. While some groups, such as homo men and people who inject drugs, may be at a higher risk for HIV, anyone can become infected with the virus. People still think that HIV/AIDS is a fatal sentence. This myth is outdated and no longer true. With proper medical care and treatment, people living with HIV can live long, healthy lives. Many people with HIV are able to work, raise families, and participate fully in their communities. Some people still believe that HIV is a punishment for immoral behavior. This myth is harmful and untrue. HIV can affect anyone, regardless of their behavior or lifestyle. People living with HIV deserve to be treated with dignity and respect, and should not be blamed or shamed for their status.
It's about HIV and AIDS. A lot of them relate to how you can catch HIV from kissing someone or from sharing utensils, nor from sleeping in the same bed or sharing a bath. So it's important to know that you can't catch HIV from normal social contact, so you can't catch HIV. It really is only transmitted sexually or through contaminated blood.
Impact on the community. The HIV/AIDS epidemic had a profound impact on the homo community, particularly in the early years of the epidemic. In the 1980s and 90s, HIV/AIDS was often referred to as a gay disease because it was first identified among such men in the U.S. This association led to widespread stigma and discrimination against such men, particularly those who were living with HIV/AIDS. Many men lost friends, partners, and loved ones to AIDS, and the disease had a devastating impact on the community. In addition to the physical and emotional toll of the disease, these men also faced significant social and economic challenges. Discrimination, fear, and misinformation about the disease led to widespread stigma and discrimination against people with the disease, particularly in the early years of the epidemic. Men who were living with the plagued fortune faced significant barriers to care, including a lack of access to medical treatment and social support. Many were ostracized by their families, friends, and communities, and were forced to live in isolation. The impact of the epidemic on that community also led to significant activism and advocacy. Organizations like ACT UP, AIDS Coalition to Unleash Power, and the Gay Men's Health Crisis were founded to provide support, education, and advocacy for people living with HIV/AIDS. These organizations played a critical role in raising awareness about the disease and advocating for better access to care and treatment. Despite the progress that has been made in the treatment arena, stigma and discrimination against this community continue to be major barriers to care even now.
So you can have a normal sex life. In those cases, you wouldn't need to use condoms because the problem is that there's stigma. So if you disclose, or when you disclose that you're living with HIV to a sexual partner, the virus is controlled and you're not infectious, there can be a lot of judgment, there can be some recoil, and that's why people need to upskill their knowledge in terms of HIV and what the risks are.
Many such men continue to face discrimination in healthcare settings, and fear of discrimination and stigma can be a major barrier to getting tested and accessing care. The cure. With the turn of the century, increased interest focused on developing an effective HIV vaccine, without a doubt the holy grail of HIV research. So far, the search has not gone well. It should be noted that currently successful vaccines do not block initial infection by the pathogen. Rather, they promote clearance of the offending agent before the disease develops. Ideally, an HIV vaccine would create a state of sterilizing immunity to block the earliest steps in the retroviral life cycle, preventing the integration of the virus to host chromosomes. Such immunity would require high titers of neutralizing antibodies, which is not possible at this time. Although researchers are still working to develop a cure for HIV, it is a complex and challenging task. Despite significant progress in understanding the virus and developing effective treatments, a cure for HIV remains elusive. Although there are effective treatments that can help manage the virus and prevent the development of AIDS. Antiretroviral therapy is a combination of medications that can help suppress the virus, reduce its ability to damage the immune system, and improve overall health outcomes for people with HIV. ART works by targeting different stages of the virus's life cycle, preventing it from replicating and spreading throughout the body. When taken as prescribed, ART can reduce the amount of HIV in the blood to undetectable levels, which can greatly improve the health and quality of life of people living with HIV. While ART cannot cure HIV, it can help people with HIV live long, healthy lives and greatly reduce the risk of transmitting the virus to others. That's all for this video, folks. Thank you so much for watching, and we will see you next time.